Welcome back to Beyond the Prescription podcast. Today we are interviewing Dr. Tanner Miller here in Olney, Illinois. So welcome, Dr. Miller.
Thank you for having me.
Yes, I'm super excited. We haven't ever met until this morning.
Yes.
But we already know we have in common, we both love to exercise, right?
Yes. That's something I got into back in high school. And grew up playing sports, but actually like weightlifting, which is my form of exercise, and have continued it. I work out 6 days a week.
Nice.
It's something that is a nice stress
Absolutely.
reliever after work.
Mm-hmm. Okay, so you do it in the evening time.
Yes, I used to. So pre-COVID, I would get up 4:30, be at the gym by 5, work out before work. And then COVID happened, and I stopped going to the gym because the world shut down.
Right.
And then, like a lot of people, developed a home gym.
Okay, so that's what you have?
So I have a gym at home. I like free weights, so I have squat rack, bar, dumbbells, and work out at home. Or I have a buddy I work out with. We'll work out at his gym.
Nice. It helps to have somebody.
Yes, it is certainly. There's a greater intensity when you have a partner as opposed to doing it by yourself, because sometimes the mental desire is just
not there.
Yes.
Yeah, exactly. So that is awesome, because I think, exercise is extremely important. But the real question is how much can you bench press? No, I'm just kidding.
Honestly, I don't know, because I don't max out, or I couldn't tell you.
Yeah,
I could tell you that I could do 185 for a 3-second negative, pause in my chest for a full second, do that for 10 reps.
Okay.
Because I just did that yesterday.
Okay, I like it. I don't think I could probably beat you in any of that or in push-ups. I'm not really good at any of the upper body, but that's all right. I'm working on it. So let's dive in. Tell us about your journey to primary care.
Well, so I grew up in Olney. From here.
Nice.
I had a chance meeting with the CEO of the hospital out of the golf course pre-med school.
Okay.
And he's like, hey, I hear you're going to med school. I said, yeah. He's like, do you want to come back? Maybe. He's like, we'll help pay for it. Deal. So
there you go.
Went to med school. I actually went to St. George's in Grenada. So I'd never been out of the country. Lived in Grenada for 2 years. It was an awesome experience. Did clinicals, the clinical portion, 3rd and 4th year of med school in New Jersey, East Coast. Nothing against people from the East Coast. Not my cup of tea. Did not like it. Too many people, too congested. Very aggressive driving. But was there for 2 years in New Jersey for that. Ended up doing residency in Peoria for 3 years before finally coming back. To uphold my end of the deal for the hospital. And I've been back since 2018, so 7 years, going on 8.
So just a couple of years out of residency, you were struck with COVID.
Yes. I think I'm probably, I would say maybe last year was like the first real regular year that I could say in my practice, because I started in 2018, had 2019, which was a normal year, but there's signs towards the end of it like, hey, what's this?
What's going on here?
What's this virus? They're talking about COVID, and then early 2020, the world shut down.
Yes.
And it's been recovering and adjusting since that. But I would say last year was probably the first year where it felt like
normal.
Yes, normal. Or getting back to what is now the new normal post-COVID.
Yep, not having to worry, about everybody who has a cough, cold, and congestion, if you need to get them swabbed for COVID or whatever. So that was...
and anybody that comes in with a cough, cold, congestion, you're not coming in and, face shield mask, N95, full gown, like, hey. Although I will say, from a personal health standpoint, the masking part in the clinic, especially during the respiratory season, I've never been healthier. Patients come in respiratory season all the time, coughing, you're evaluating them, and inevitably you will catch something. masking, I was like,
That helped.
this is great.
Yeah. Yeah. Even like with like against flu and
Oh,
all
yeah.
that.
Just
other,
the common
yeah.
cold stuff that they're
Yep.
going to come in for that was non-COVID or influenza. Yeah.
Yeah, that's a good point. So something that you were passionate about is something that we would call, like in the healthcare system, we call comorbidities. So what is a comorbidity, if you can explain that to our listeners?
So we'll say a comorbidity is a coexisting condition. It contributes to worse health outcomes, but is not necessarily caused by a primary condition. So an example, let's say, is hypertension. So you have high blood pressure. We'll call that your primary condition. A comorbid condition might be obesity. It might be high cholesterol. It could be diabetes. The high blood pressure did not cause your diabetes. The high blood pressure did not cause your obesity. But those two are correlated in that they make your health worse because they both exist.
What is it? So whenever we talked just a little bit and you said there's a lot of things that I see in primary care that could be, in a sense, almost prevented.
Yes. I would say probably 90% of everything I see in the primary care setting is self-inflicted or diet-induced. Okay. So, I mean, I'll lump COPD into there and we can talk about that, but, self-inflicted. But your high blood pressure, your obesity, your high cholesterol, your cardiovascular disease, your diabetes, that is the bulk of, if you don't have one or a combination of all of those as a patient that I'm typically seeing, that is in general diet-induced. I mean, each one of those, the pathogenesis, it's multifactorial. There's genetic and environmental and other things that contribute to it. But the underlying thing is going to be kind of insulin resistance. And as you over-nutrition yourself, you gain weight.
Yeah.
And as you gain weight, you develop insulin resistance. So your fat cells, they get bigger, you get more of them. There's a process called lipolysis where it spills fat into the bloodstream. Your liver is the vacuum cleaner and cleans that up. It produces very low density lipoproteins, which decrease your good cholesterol, your HDL, increases your bad cholesterol, your LDL. It creates insulin resistance in the liver, the skeletal muscles, the adipose tissue. So you have more insulin resistance. Your pancreas compensates by trying to produce more insulin, which is anabolic. So it causes storage. The insulin's goal is to take the blood sugar from the blood vessels and store it. We typically store that in muscles and in fat and in the liver. So you become insulin resistant, you produce more insulin. Insulin stores the energy. You gain more weight, more fat, more insulin resistant, more insulin. And then that eventually leads to a relative insulin deficiency compared to what the blood sugar is there, and you develop diabetes. And along the way, you're spilling that fat into the blood vessels. Your liver's producing bad cholesterol, so now you've got high cholesterol. You've got diabetes. This is affecting the endocrine system, is affecting the blood flow to the kidneys. It's upregulating that. You're developing high blood pressure, and now you've developed what's called metabolic syndrome, which is you have dyslipidemia, so high triglycerides, low HDL. You have central adiposity, or you're obese. You have high blood pressure, and you have elevated or impaired fasting glucose, or diabetes. So you develop all of those, and it's all through overnutrition, eating too much and eating the wrong stuff.
Processed foods, right?
Yes, I've got a whole spiel that I give to all of my patients. And I tell them this, it doesn't matter if you were coming in and you were talking to me about your blood pressure, if you were talking to me about your diabetes, your cholesterol, heart disease, obesity, whatever your problem is that you're wanting to address, the underlying fix is the same, and it's diet. And it's a focus on whole food over processed food. Whole foods were living things. We harvest them, we eat them. Processed foods were those, and we do stuff to either take stuff away or add stuff to it before we put it on a shelf in a store. And I try to tell them the healthiest things you can eat don't have food labels.
Right.
fresh produce.
Yep.
So focusing on a whole food, plant-based or plant-focused diet. So it's heavy in your vegetables, your fruits, your legumes, nuts, your plant-based oils like olive oil, and whole grains, with less amounts of fish, poultry, ideally limiting, we'll say, land meat as much as possible. So your pork, your beef, things like that, as well as your dairy products. If you're going to do it, do low-fat dairy, but in small amounts, minimal amounts. That's the healthiest way you can eat. And that will impact all those conditions. And if you follow that, those conditions will get better.
Let's talk about the food pyramid that we all grew up with.
Yes.
So what in the world was going on with the food pyramid, and that they just like told us every, year in school and health or whatever, you have your majority of carbs, right? Down there at the bottom, that thick layer.
And so carbs or carbohydrates are not a bad thing. That is the simplest thing that your body wants. That's what your brain wants. It wants to have that glucose as its energy source. So carbohydrates are not bad. Your body needs it. That being said, there are complex carbohydrates that you're going to get from your whole foods, and then there are processed simple sugars, which are the things that you want to avoid. So that would have been the very top of the food pyramid, is the things that you should avoid. But there's other stuff that they had on the bottom of it.
It was all
like
bread.
Cereals and things. And bread, not necessarily bad. So a whole grain is not a bad thing. And the most important thing about a healthy diet, and I hate using the word diet because it seems transient and temporary.
Lifestyle.
The healthiest thing about your nutrition is that it's sustainable. You have to be able to do it. It's not a fad that you're going to do for a little bit to achieve a goal for a short period of time and then revert to what you were doing. So this has to be, like you said, your lifestyle.
For example, like you said, it's got to be, you have to be able to continue it, instead of just like a short time. But whenever you are looking at the modern American diet,
it's horrible.
We want anything fast, we want convenience, things like that. So we are going towards more, or we already have. We've already gone to all these processed foods, these breads that are like not healthy for us. They're simple sugars. They just develop right into sugar, causes the insulin resistance. And then now, do you feel like there's a shift though in people's mindset on maybe this isn't the right thing for our bodies to do?
Yes.
I do too.
So there's definitely a shift and definitely a focus on what is the healthiest way that I should be eating and doing things. That being said, there's a lot of influence and misinformation about, keto is best. Eating paleo is best. Eating raw is best. There's no evidence that one specific diet style is better than the other. And I think because we are in a society now that is fast-paced and is convenient, and you have any information that you want at your fingertips and your phone that's constantly on you, people expect kind of the same thing with the results for their health.
That is true.
And it doesn't work that way. So you didn't become unhealthy overnight. That is a years-long process of things that you've done. So you can't expect that result to change overnight. It's going to be likely a years-long process of lifestyle improvement to get there. So is society in general recognizing that, hey, yes, I mean, there's a political component to that too, of not trusting necessarily what comes out from the government.
Right.
But I think we're at a point where we want the quick fix still.
Yeah.
And that does not exist because it wasn't I went to bed healthy and woke up unhealthy. So I can't do that in reverse.
Right. So whenever we were talking about the patient being able to do a lifestyle change that is manageable and that's going to last, I've also tried to do a lot of things. So for example, I bought like wheat berries and I grinded them up and I made my fresh bread just from wheat berries for months and months and months. And then Well, life got busy and I couldn't stick with it.
Yeah.
So then you go through the guilt and the shame of, I'm no longer doing that. But I do feel like that there are, like, even at Walmart or even at like other grocery stores, farmers markets, things like that, there are being able to be more options. But what is something like if you were with your patient and they were overwhelmed by all these lifestyle changes, what is the one thing that you're going to be like, hey, this is it right here?
I have this conversation with my wife all the time. She says, you can't just unload on a patient and like expect them to change everything. I was like, don't worry. Like, I've done this before. We usually pick one thing. So most people will recognize something in their diet that is, I shouldn't be doing that. And I will use soda as the example here, especially in our area. Soda, sweet tea, going to ginger ales, they recognize I shouldn't be doing that. So I tell them, these are your three options. You get water, you get black coffee, or you get unsweetened tea. Don't drink anything else. That is what you're focusing on right now. Don't worry about the next stuff. Don't worry about the food yet. Let's just cut out those simple processed sugars from your beverages.
How long do you give them? 30 days, 3 months?
I want them to try it for at least 3 weeks. If you do 3 weeks, you probably get a habit of it. So do it for at least 3 weeks before you would consider changing something else. And if someone's like really serious about this, hey, we'll come back in a month and we'll see how the progress is. Help keep that accountability. Because if I say, yeah, I'll see you back in 6 months, the accountability's gone. They'll try it for a little bit. They'll fall off because something happens. Life happens, maybe there's a death, maybe there's a celebration, there's a wedding, maybe there's a birth. We go out for a birthday, they fall off.
Right.
Then they stay that way for several months and they go, oh, doctor's appointment's coming up in a couple weeks. And then they start it back 1 or 2 weeks before the appointment and like, I haven't really done it. So helping them close follow-up for accountability, but just picking off one thing at a time. Okay, we fixed beverages. You're just drinking water. You feel better. You saw some success. You feel you've lost a little weight. Your blood pressure is better, or your blood sugars are much better controlled. Like, great.
Yeah.
So what next? And then it's usually picking off like, well, I eat, pizza 3-4 nights a week. Okay. Let's cut it down. We're not going to eliminate pizza because if you're doing it that often, we're not going to.
Because pizza's good.
Yeah. So it's, I would say a good comparison would be like treating it like cigarettes. If you're a pack-a-day smoker, you're not going from pack-a-day to nothing overnight. I mean, some people might have that willpower to do so, but that's not normal.
The majority.
That's not going to be the majority of people who are going to do that. So this week, we're going to work on cutting it just in half. Next week, we're going to cut that number in half. And the next week, we're going to cut that number in half. So that over the course of 4 or 5 weeks, we've guided you from a pack a day to no cigarettes.
Yeah.
So the same thing with the diet. We're going to work on just this. We're going to work on this for a couple weeks. And then we're going to scale it back a little bit more. Or then we're going to work on this thing.
Yeah.
And then always having that accountability and follow up. And once they start seeing success in whatever their goal is, so I use weight as the example here because that's the one where I have a more in-depth conversation about diet because it's going to have the biggest impact on it.
On their health, yeah.
So once they start seeing, oh yeah, I lost 5 pounds from last month, great. And then always setting goals too. So in that instance, the goals, let's lose 1 pound a week.
Right.
So if you think my goal is to lose 50 pounds, oh, that sounds like a lot. That sounds like a lot of work. It sounds like a lot of effort. But if I say you've got 7 days to lose 1 pound, you go, oh, that seems doable.
Yeah.
That seems much more manageable bite. And then over the course of a year, you've lost your 50 pounds.
That's awesome. Yeah. Very good. Very good. And I'm assuming that you were seeing this like with your patients. There's probably a larger percentage, I feel like, that is willing to make these changes now compared to some patients. I feel like we used to be, well, just give me a pill,
Yeah. And well, especially now with the new GLP-1 medications, which are very effective. And I think they will do amazing things for the health of patients in the future, long term. Right now, cost being a huge barrier.
Right.
But also, I think it really helps with that accountability and buy-in. You know, if you're doing a gym membership, depending on the cost of it, you're like, I'll be maybe more accountable to go to the gym because I'm paying for it.
You got some skin in the game.
Yeah, you got some skin in the game. So the GLP-1s, certainly because cost is likely prohibitive, and if people are paying for it, even if insurance covers a portion of it, there's more skin in the game, so they are more willing to make those adjustments. But I've had a couple patients who they start and they see that initial success. There's one in particular, he's in his 60s. He did start on a GLP-1 just to, like, I need to see that, that reassurance, that affirmation, that confirmation that what I'm doing is working.
For sure.
But it was going from eating very unhealthy and not working out to lifting weights multiple times a week, riding a bike every day, swimming routinely multiple times during the week, complete overhaul in the diet, eliminating alcohol from his diet, and has lost over 100 pounds.
That's amazing.
Just super great.
That's great. People like that, I don't know. I just think that's whenever they make those changes, like let's say like their whole family, their family never focused on exercise. They never focused on eating right. And then they come in and they make these big changes. I feel like that is an impact for generations to come on their family.
Absolutely. And especially if the family is willing to support you through that and then do that with you. So same, like if you're a smoker trying to quit smoking and your partner is smoking in the house,
right.
They're not setting you up for success. But if your family is going, yeah, we're going to, if whatever you're eating, we'll eat the same thing, not you eat that, but we're ordering pizza, like not helping.
Right.
But if they're willing to support it and go through it with you, way more success. Also from a generation standpoint, you know, parents doing that, showing their kids, this is the way you should be thinking and eating when it comes to your nutrition. And
Absolutely.
then the other component that we really haven't touched on, at least from a patient standpoint, is exercise. And I like to specifically use the word exercise and not activity, because a lot of patients, at least anecdotally for me, they go, well, I'm very active at work. I go, okay, well, that's your regular life. We need to go
above that
for exercise.
Yep.
Unless your job is digging ditches by hand, I'll excuse it. Let's add a dedicated exercise. And also, that doesn't have to be running. Personally, I hate running. It is boring. I'll swim. I don't mind doing things that create a cardiovascular component, but actually just going out, we're going to go on a run. If there's a point to it, we're playing a game.
Yeah.
If I'm being chased, sure. But for exercise purposes, I don't like it. It's not enjoyable for me.
Yeah.
So I tell patients, it's whatever you like to do. If it's yoga, if it's just going on a brisk walk, do something that's going to get your heart rate up. You got to breathe heavy. I gotta struggle to have a conversation. Do what you want. If it's weightlifting, lift weights. If it's swimming, biking, whatever, but have dedicated time that you're doing that. And from a cardiovascular standpoint, at least the guidelines are going to recommend, so the American College of Cardiologists or the American Heart Association, 30 minutes a day, 5 days a week.
Or 150 minutes per week.
Yes, or an equivalent of that, which will be 150 minutes a week. So if you want to do an hour, I do an hour 3 days a week as opposed to 30 minutes 5 days a week. As long as you're getting that 150-minute goal in, that's what you should be targeting.
Right. So yeah, I also have had a lot of patients be like, well, I'm active, I at work, I have to walk from one side of the building to the other multiple times a day, but that's a really good point. You have to go above that. Your body's already used to what you're already doing, and it's obviously not working.
Yes, you're not. And the argument I also give to patients is you're not going to out-exercise a bad diet. You can't exercise. You're not likely to exercise enough to combat the poor caloric nutritional choices that you're going to make.
Right, exactly. So I do like to run. I don't run right now, but running is my stress reliever. But then also I do like a lot of weightlifting. So I really think it is important that you were talking about something that you enjoy. It's got to be something you enjoy, because if you're just doing something that your friend's doing,
Yeah.
and you don't really enjoy it, you're going to tap out. You're going to be like, I'm done.
Yes. So, I mean, the same thing with the nutrition. It has to be sustainable. So it has to be something that I look forward to doing this, or I feel good after I do this, and just incorporate that. So if you like running, run. If you like going on a walk, go on a walk. But do enough that you're getting benefit for it. Not,
Right.
I'm going to take a walk around the block and that's it. Maybe that's where you start, but you got to build up. You got to
Right.
keep building on that.
So like comorbidities preventable, like let's say, and I know there's the genetic aspect of that. So some things, even no matter what you do, sometimes you still run into a little bit of trouble on some things.
Yeah.
But overall, comorbidities that we can help prevent would be, what would be things that patients can help prevent as they start to age
So
with their lifestyle?
everything that we've talked about. So high blood pressure, diabetes, obesity, heart disease. So that being risk for heart attack and stroke, high cholesterol, hypertension and diabetes are the number 1 and 2 causes for chronic kidney disease. So your increased weight gain and high cholesterol are going to lead to fatty liver disease, which eventually can precipitate inflammation that leads down towards cirrhosis. So you can prevent a lot.
Yeah.
The other thing, as we age, there's a lot of mobility loss, which is going to increase your risk for falls. So, and fragility fractures. Diet's going to play a big impact in the fragility fractures, but activity is going to play a big component to mobility and falls. So, I mean, you're looking at longevity. You're looking at avoiding fractures. You're looking at avoiding joint replacements. You're looking at
Keeping the muscle mass up.
Yes.
If you can help with all of that, right?
Osteoporosis, like especially in women, like resistance training is going to be beneficial. And the earlier you start it, probably the more beneficial it is. But certainly to help with that bone strength, as we age, especially in women, you're going to be at risk for
that. Getting like the
osteoporosis.
little bit of like that kyphosis there.
Yes.
As you start to age.
Yeah,
And,
you get that.
Yeah.
You get down here, and your chin is getting closer to your chest.
yeah.
Yeah.
Yeah. It is excellent to hear that, and for our listeners to hear what they can do, small steps, obtainable steps, things that are going to last. Would you say that you feel like the healthcare system today, do you feel like it supports or hinders all these things we've been talking about, preventative lifestyle?
I would say neither. So it does not, I wouldn't say it necessarily hinders. And in general, we're trying to, as a health care system, make a push towards value-based care and, incentivizing quality preventative care as opposed to reactive, which is what we currently are doing. But I don't think it is supportive. And here's my soapbox answer to that. Medicare wellness visits. Those are great in theory, but in clinical application, they are checking boxes. It is not, in general, the time to be maintaining your wellness at age 65. You've probably already developed chronic diseases
At 65.
at 65.
If you haven't
with
done anything.
1 in 3 Americans having metabolic syndrome and 2 out of 3 being overweight. And of those 2, half of them are obese. And that's just climbing.
Yeah.
You have chronic conditions that have already developed by the age of 65.
Yeah.
So in theory, the concept of an annual wellness visit is great. In practice, from a Medicare standpoint, I mean, you have to be on Medicare, so starting age 65. It is no longer preventative. It is. Let's just make sure that you're not getting worse.
Yeah, let's see if we can find some problems, like,
Yes.
have you fallen, or how many times do you fall a year? Yeah.
And screening is not necessarily prevention. So
Right.
screening for screening mammograms aren't preventing breast cancer. They might prevent some morbidity and mortality related to breast cancer because we're catching it early, but it's not going to prevent the breast cancer. Same thing with colonoscopy screening. Screening for colon cancer is not preventing it. It's catching it early. Preventing colon cancer, a lot of diet goes into that.
Right.
Across the board, the American diet deficient in fiber. And there's way too much processed meat in it. And just as cigarettes are a known carcinogen to the lungs, processed meat is a known carcinogen to the colon. The more you eat, the higher your risk of developing colon cancer. So prevention from that standpoint is not through the screening. So if you were able to have a health system where you start that Medicare wellness at like 35, 40, we're going 25, 30 years earlier, we're probably preventing disease. We're probably maintaining your health because we're going to focus on all these things. We're going to focus on blood pressure, diabetes, prevention. We're going to focus on weight reduction. We're going to focus on the screening tests as we need to, but at 65...
We're too late in the game.
Yes. We should do it. We should, at that point, you've missed out on, if you haven't been to a physician, you haven't followed up, you haven't done the recommended screening, you've missed 25 years of breast imaging. You've missed 20 years of colon cancer screening. You've missed, 10 years of prostate cancer screening. So
Yeah.
we're too late in the game.
Yeah, and that's a good point because, like, whenever, pediatrics, they have to have their wellness physicals for school. So parents are bringing them in because they have to have that form filled out, right? They get the form filled out. So sometimes the last time that you can even have contact with the patient might be before they go into their freshman year, or if they go into college, maybe they might need one then. But if you don't really have any problems, there's a huge chunk of your life and a lot of the population, they're not going to the doctor.
I feel fine.
Right.
That doesn't mean that doesn't mean that your blood sugars aren't high.
Right.
That doesn't mean that your blood pressure is not high. You're not really going to feel that until it gets way too high and it's an acute issue right now.
You get to a threshold and your body is just like, I'm done.
So, you feel fine.
Yeah.
But that doesn't mean there's not problem there. So if we could start doing those wellness visits, just like for school, for kids, and then you can also see a trajectory on things. So, not a pediatrician, so if I misspeak in this, excuse it. But you're looking at growth charts. What is your height? What is your weight? Are they trending appropriately? Is one significantly off? Is one downtrending? Same thing as an adult. Like, what was your weight last time? What's your weight this time? What's your blood pressure last time? What's it this time? What's changed? If you have that routine touch-based screening thing.
What if we could do a graph for a waist circumference?
So that's we really need to. I'd be super supportive of that. Instead of like step on the scale, arms out, we're gonna measure your waist. But there's a lot to support. We use BMI. It's not a perfect tool, but it's a measure that we use. And we have ranges for this is considered healthy, this is overweight, this is obese, and then et cetera. But a waist to height ratio is probably a slightly more reflective health measure than just BMI. Because BMI, if you have someone who is very muscular, very fit, maybe their BMI's falling into a higher range than someone who is not muscular at all. It's pure, their body fat percentage is significantly higher. Those are two different people that could have the same BMI.
Right.
So it's not a perfect tool. But a height waist ratio would be, if we could just incorporate that
Let's
consistently.
make that graph. Let's patent it.
I don't know if there's a patent. There's a measurement.
Well, no, we can patent it. We can name it something, and then you have the Denver, and you have all these screening protocols and stuff. We could just do a waist circumference one, and there's probably something like that already out there.
Probably is already something out there.
But so to wrap this up, let's say there's one thing that you want to leave for our community. Just one thing. You're in healthcare for a reason. You're obviously passionate about people's health
Absolutely.
What is the one thing that you want people to know?
It is never too late to change your lifestyle. You can make that change at any time. And the sooner you do it, the healthier you'll be, the better you will feel, and the more longevity you will have.
Awesome. Well, thank you, Dr. Miller, with hanging out with us this morning. We've had a good cup of Joe this morning, and it's a good summer day. And we're just thankful for our listeners here today on Beyond the Prescription podcast. I hope you just listen and absorb some of this. Be intentional about your daily choices, and we want you to keep thriving.